much relaxation is there, if too much relaxation is there, naturally the air will not pass. And at that time, breathing will stop. That is just for 10 seconds. But imagine these things happen in a half an hour time, 30 times. So it has to be taken very seriously about this. And the other part, which is also called as obstructive sleep apnea, normally the muscles. However, some people have a narrow throat area, and during sleep, the relaxation and snoring comes. The snoring is not just disturbing the others in the room or in the maybe the neighbor, but it is worse for the patient. Then there are some tricks how to avoid it, what are the methods, how to conquer about it, and how to stop snoring. Sleep on your side, elevate the head of your bed, elevation, and remove alcohol and medications. Clear your nasal passages. Now this should be underlined because it has nothing to do with the pharynx and the throat, the muscles. So clear your nasal passage and lose weight. This is again important. Why lose weight? Because these muscles, which suppose if the weight is more, the muscle weight will be more, then they will block the small narrow passage for the air to go will be also blocked, and less air, less oxygen, breathing problems all will start because of the overweight. Daytime sleepiness is also called as narcolepsy. It's a chronic sleep disorder. The condition characterized by excessive daytime sleepiness in which a person experiences extreme fatigue and possibly falls asleep in an appropriate time, such as while at work or school. So these is often confused with insomnia, but this is not insomnia. This is different thing. When a person, how to know it that it is not insomnia? Again, it is depending upon the brain waves. The brain waves are studied by the sleep experts, and they found that REM stage of a sleep, rapid eye movement, within 10 minutes, whereas most people, this should occur until generally 30 minutes. So 30 minutes, instead of 30 minutes, within 10 minutes, the REM starts. In case of daytime. Then there is a circadian rhythm. It's nothing but a cycle. As there is a cycle of the day and night of 24 hours. Our body is also having a cycle. But that cycle is not exactly 24 hours. 24 hours, something more, or half an hour more. So this is especially apparent in travelers. So jet lag is important. Whenever they are moving from one time zone to other, they get a jet lag. So what is the difference between the jet lag and the general traveling? If I travel for 5 hours, 10 hours, then also I will not get sleep. But jet lag is different. Jet lag is going to be more fatigue, nervousness, and other things compared to just traveling. Because traveling, recovery is fast. The basic difference between just traveling and the jet lag, that is from one time zone to other time zone, the recovery is not fast. Recovery takes at least 1 day per time zone. Periodic limb movement disorder. This is a movement where there is a jerking of the legs during the sleep. This is again an abnormality. The periodic refer to the fact that movement are moving and rhythmic occurs about every 20 to 40 seconds. Sleep duration as a factor of diabetes. The average sleep duration decreased from an estimated 9 hours in 1910 to 7 hours in 2000. So that although it appears to be just 2 hours, but the increased burden on the pancreas from insulin resistance can over time compromise beta cell function and lead to type 2 diabetes. Then the pressure on the pancreas will secrete the insulin because of the lack of sleep. And then the diabetes percentage increased by double than the normal go through sleep for 7 hours. However, sleep is also related with the depression and inability to sleep or insomnia. insomnia is one of the signs of depression. Lack of sleep alone cannot cause depression, but it does play a role. And inability to sleep that lasts over a long period of time is also an important clue to someone in this case. Overweight and obesity, as I have told you, is also related with the less amount of sleep. And this report in Science Daily in 2005, the Chicago, it has been reported that the average American is currently getting less sleep than they did a century ago. With these declining sleep times, there has also been an increase in the number of both obese and severely obese people in the East. The reason is the hunger controlling hormone secretion is reduced because of this substance. Now these are the tips which are very important behavioral tips to improving the sleep quality. Bend down routine before going to the bed can be relaxed and make it easier to sleep. This can include activities such as reading, having a warm bath, or listening to music. Relaxation exercises such as progressive muscle relaxation, but these exercises should not be done before sleeping. Breathing techniques can reduce anxiety and assist sleep. This is particularly useful for the condition of insomnia. Insomnia is generally excessive worry about not sleeping. This is also possible. If after some time sleep does not come, get up and go into the another room and do a relaxing, quiet, soothing activity, such as listening to soothing music, then return to the bed. This is reported in the Australian Family Physician. Avoid smoking at least 2 hours before bedtime. Nicotine is a stimulant, so it's a relaxation is not possible. Daytime sleep adds to your 24-hour sleep cycle and avoid naps as far as possible. So if daytime sleep is there 1 hour and the patient will complain at night, I am not getting sleep because its cycle is switching. Put the bedside clock out of view to avoid clock watching at night. So the first thing at least we can do it, the clock should not be there. Because it happens at night when somebody gets up, then what is the time, and then that worries the patient. The routine is critical. Getting up around the same time each day helps to save day and night clock. A consistent waking time is more important than sleeping. And a consistent waking time and sleeping time suggested by some of the reports is 11 o'clock at night and getting your rest, which is nowadays impossible. Noise and lights, avoid stimulating activities such as work, written discussions before going to sleep. Avoid caffeine, that is coffee, cola, chocolate, within 8 hours of it. So you have to decide if I am going to sleep at 12 o'clock, then after 4, I should not take it. So that, because coffee makes the melatonin secretion less. It reduces the secretion of melatonin. Avoid alcohol within 6 hours before bedtime. It can reduce the quality of sleep.